Venous thromboembolic disease causes more deaths in the United States than breast cancer, prostate cancer, HIV, and all accidents put together. Venous thromboembolic disease consists of two discrete but interrelated conditions. One is when you form a blood clot in the deep veins of the leg, and that is called deep vein thrombosis, or DVT. Now, when these blood clots break loose and travel through the heart to the lung, that condition is called pulmonary embolism.
The blood clot in the lungs suddenly obstructs the flow of blood from the heart into the lungs. And when that happens, the patient's right side of the heart becomes very strained.
The strain on the right side of the heart is so overwhelming sometimes that, boom, end of story. The patient drops and can die suddenly. And we always say, oh, patient had a heart attack. I actually believe that a lot of those patients, or a lot of those people, individuals who die suddenly, are actually dying from pulmonary embolism.
Unlike heart disease and stroke, which is decreasing annually, venous thromboembolism is increasing every year in the United States.
It kills 180,000 people each year just in the United States. And it happens in all ages. Many athletes can develop it, many pregnant women can develop it. Recently, Serena Williams had a pulmonary embolism after her pregnancy. Another common precipitating factor is long-distance travel in an airplane. People have died after a long flight because they developed a blood clot while they were flying.
Patients after surgery tend to develop blood clots in their legs because of immobility. If a person suddenly develops swelling in one of their legs or feet, or develops sudden shortness of breath and they don't understand why, one of the things that this could be related to is a blood clot either in the legs or the lungs.
The things that you might start feeling are you can't walk as far, you have difficulty climbing the stairs, you have some chest pain, you just don't feel yourself. You get a little bit more sweaty than usual for minimal amounts of activity.
It is what I call the great masquerader. It can present like the flu.
Pulmonary embolism is a very difficult condition to diagnose because the differential is so large.
So it's a big challenge for our community to increase the awareness of this condition. The good news is we do have effective treatments for this condition, and the treatments can be implemented very quickly. There are several blood thinning medicines that can be given intravenously, or we can treat it with the catheter-based techniques.
What the Bashir catheter does better than a standard infusion catheter is expose more of the clot to flowing blood. We're assisting the body to do what it is naturally supposed to do, which is to get rid of this clot on its own, and exposing more of the clot to the thrombolytic drug that's being infused. And that will allow us to give less drug over less amount of time, thus making it easier on patients and safer with the same efficacy.
I'm really excited how we can harness the current technology to treat these industrial-sized blood clots. And if we could prevent this complication from happening, we could save a lot of lives.